It's a Northwest News Radio weekend. IRG's Health Talk continues.
Our first guest is Dr. Trevor Barronian, fellowship-trained orthopedic surgeon at Olympia Orthopaedic Associates, the Westside Clinic. And he's talking today about hip and knee replacement and reconstruction, Shannon. And this is an ever-evolving process.
Oh, my gosh. I mean, I often say, and I say this all the time, I mean, this process has evolved so much since I initially became a physical therapist 35 years ago. I mean, the type of surgery, the technology, the type of prosthesis that they're using, I mean, and then the training. I mean, Dr. Barronian is a fellowship-trained orthopedic surgeon specializing in joint replacement, hip and knees. So I'm excited to talk to him.
All right, Dr. Trevor Barronian and Shannon O'Kelly.
Dr. Barronian, how are you?
Good. How are you doing today?
I'm doing fantastic. I'm excited to talk to you. I'm always excited to talk to folks that come on Health Talk. Health Talk is a show about health, and you're an orthopedic surgeon and you're fellowship trained. You know, I always like to start out with our listeners a little bit about Dr. Barronian. Tell us about yourself, your training, your background, how you got interested in orthopedic surgery, and why Total Joint Fellowship, where you work in hips and knees and hip and knee replacement. Maybe you can give us a little background on Dr. Barronian. How about that?
Perfect. Sounds great. Thanks for having me on the show. And yeah, just to start off, Dr. Barronian, I'm a total joint surgeon down in Olympia at Olympia Orthopaedics Associate. I'm actually a local native. I grew up kind of in the Burien, Normandy Park area, just south of Seattle. Went to University of Washington for undergraduate, and then did my training down in Portland for the majority, and then a fellowship in adult reconstruction over on the East Coast. My interest in orthopedics stemmed a bit from my childhood. My father actually still practices orthopedics up at Highline Hospital, or what used to be Highline Hospital in the Burien area. And so it's something I had the opportunity to grow up around with, every day. And I think growing up, one of the things that, impacted me the most watching him is, within the community, whether it's at the grocery store or out at sports games or whatever it is, interacting with patients that he's taking care of and seeing the excitement they have when they saw him, and often hearing them report, all these activities in life they were able to get back to doing as a result of his care. And I think that was something that was very exciting and fit well with my interests in, the science and biology within college.
Yeah, so you kept it in the family. There you go. That's great.
Yeah,
I mean, it sounds like you had great training from an early age. So tell me about your fellowship. You talk about a fellowship on the East Coast. And for our listeners, when you describe your fellowship, tell our listeners what that means. I mean, you've got some specialty training in total joint replacement, particularly hips and knees. But talk about your fellowship training. I think that's pretty fascinating.
Of course. So the world of medicine is a very complicated one and confusing. So it's always hard for people to understand that. But in the world of orthopedics, we spend 5 years training at our residency program to be proficient in the entire field of orthopedics. So shoulders, hands, knees, feet, whatever that is. But as a result of that, it kind of stretches you thin. And so the goal of the fellowship is it's an extra year of training to allow us to focus on one specific area and become much more proficient in that area. And so for myself, I chose adult reconstruction, which what that means is, hip replacements and knee replacements primarily. And the interest in that kind of stemmed from patients that I take care of tend to be on the older end of the spectrum. The sports doctors will take care of our young patients. Us joint surgeons take care of the older population. And I think sometimes it's a population that can get overlooked. And many patients get to that stage in life and they feel like these aches and pains are something they have to live with. And they've kind of come to terms to basically living life at a decreased level of function. And joint replacement, I think, is a very reproducible and successful way to bring patients who have arthritis back into at least close to their former level of function, which is a significant enjoyment. And within the realm of fellowships, one of the things it allows us to do is obviously focus on that area in depth so you can learn, kind of the newest techniques, the cutting edge techniques for both the hip and knee replacements as well as the more complex surgeries. So if someone's had a hip or knee replacement that's failed, taking them back and giving them a new one that now functions and kind of correcting that failure is another big focus of fellowship. And so, the opportunity to see a lot of those over and over kind of builds that confidence in that skill set to allow you to focus just on that area.
Yeah, it's a 1 year intensive training program just in total joint replacement, both hips and knees. You mentioned arthritis, and we're going to have to take a little break here. But when we come back, I'd like to talk to you about that type of arthritis that we're talking about when we talk about the need for total joint replacement, and then maybe talk about what that patient may experience when they come see you and then they progress to maybe needing a joint replacement. We're just going to take a quick break here. We'll be back with Dr. Barronian in just one moment.
More with Trevor Barronian and Shannon O'Kelly next on Northwest News Radio.
It's a Northwest News Radio weekend. Here's Tom Hutler and Shannon O'Kelly. This is IRG's Health Talk.
We continue our chat on hip and knee replacement with Dr. Trevor Barronian and Shannon O'Kelly.
Dr. Barronian, again, thank you so much for joining us here on Health Talk. We talked about arthritis. I mean, I think sometimes there's confusion. Do I have arthritis? What kind of arthritis do I have? This is osteoarthritis, so maybe describe that.
Exactly. And I agree 100% that is a common question I get, and I think an area of significant misconception. Kind of in simple terms, what arthritis is a wearing out of the joint. So anywhere bones meet in the body, they're coated in the cartilage tissue. And you can think of it as a cushion, right? Mm-hmm. All arthritis is that cushion can wear out with time, either with genetics, injuries, overuse. But unfortunately, as that cushion wears out, it starts to hurt and it creates kind of inflammation, stiffness, pain that are kind of the hallmarks of arthritis.
Yeah, and that cartilage you're talking about, we identify it in anatomy as hyaline cartilage. It's very resilient, but it does not have a blood supply. So when it starts to wear out, it just continues to wear out. Let's do a little game here. I'm a patient, 55, 60, 65 years old. I start getting some of those symptoms, stiffness, pain. My quality of life is now changing. Tell me the process there and the decision-making to replace my hip.
So when, I see a new patient in the clinic, obviously the first thing to do is assess, is this truly arthritis? And that's simply done with just an x-ray. Once we've made that diagnosis, then we kind of talk about treatment. You brought up a great point that unfortunately, once the cartilage is worn out, there's no way to replace it. So when we talk about treating arthritis, it's either trying to manage the pain, which is medications, injections, other modalities, or the arthritis has progressed to the point where it's limiting them enough that they can't function in a day-to-day manner. And so that's when we talk about the joint replacement. So when I meet a new patient, the first thing to do is just assess how much is this limiting someone. If it's more severe or they've tried those other things, then it would be talking about that hip replacement or that knee replacement.
And then if that's the decision that's made, that replacement takes place in an outpatient environment. Is that pretty fair to say that you're doing most of these in the outpatient, minimally invasive surgery, sometimes a quicker recovery?
Especially on the hip side of things, yes. Over the last 10 to 15 years, we've made significant advancements. So these are patients, especially young and healthy ones, they come in and go home the same day. After surgery, there's no restrictions that we place on these patients, or at least for myself personally, so they can walk, use it as tolerated. Working with a therapist, obviously, which is an important part of the post-op recovery. But the surgery itself, takes about an hour and a half. They're in the hospital for 4 to 5 hours total for the whole event. So while it is a surgery and still a major surgery, it has become much more streamlined and much more of an easy recovery or tolerable recovery. Knees are a little more complicated and a little more of an involved recovery, but still, these are patients that can come in and go home the same day if they choose to and have their support at home and are healthy.
And the good news is that, once they recover, what I've experienced, what I've seen, most people will tell you, wow, I wish I would have had this done a lot earlier. I'm able to do the things that I love to do without pain. And you can do quite a bit of activity with a total knee and total hip. So it really doesn't change your activity level that much. Is that fair to say still?
Oh, 100%, especially for, hip replacements. We tell patients, listen, they can go back to any activities they like. And same with the knee replacements. And a lot of patients will even forget they have a joint replacement. So it's a great solution for people who feel like they're limited due to their arthritis.
Dr. Barronian, thank you so much for your time today, okay?
Of course, happy to be here. Thanks for having me.
You've been listening to Dr. Trevor Barronian and talking about hip and knee replacement. More info at olyortho.com. Shannon, we mentioned at the top, this is something that just continues to evolve. Boy, I had my knees replaced back in 2000. The changes since then are astronomical.
Quality of life, Tom. I mean, if you're not able to do what you want to do or like to do, these total joint replacements are pretty slick. And most people will tell me after they have it done, wow, I wish I would have done that a long time ago. I'm back to enjoying what I would like to do. So they've come a long way.
That's what it's all about. Our next guest right after this time out on Northwest News Radio.